Hi guys, welcome back. Some new improvements. I improved some of the lighting here in the Mad Medics secret broadcast base. And today we're going to talk about oxytocin. And oxytocin again, delivering one good baby at a time. That's so very true. And the reason that I'm going to go over this is it's going to be carried on the trucks, probably not. Or you're going to have to know about this drug, especially when you are taking somebody and they put them on this drug. It's very important to know, and they'll go, oh, it's okay, they'll make it. You need to be hitting the brakes if they say that they've been on this drug. Okay, so Pitocin is the other name for this guy. It's a naturally occurring hormone. It means technically rapid birth, okay? The class is oxytocic, which means basically it causes the uterus to contract, okay? It is a pituitary hormone. Yes, it is naturally found in the woman's body. This is the hormone that stimulates everything to start having the baby. Okay? Smooth muscle contractions in the mammary glands. It increases sodium permeability for those guys. It reduces labor for selected cases. The other thing that it does for us is it helps with the postpartum hemorrhage. When you've got a patient who's not exactly stopping bleeding with a fundal massage, this is a drug that we can give to stop and control the bleeding, okay? Now, it does increase the renal, coronary, and cerebral blood flows, by the way, and it stimulates the mammary glands to increase lactation without increasing the production of milk, okay? So that's one thing. You can't just give them oxytocin and boom, they'll have more milk. Nope, it doesn't work that way. So when we give it IV, it's usually immediate. It's usually in a drip form, by the way. They can also give it IM. They'll give an injection of it usually 20 minutes after you stop the infusion. It'll wear off in about 30 to 60 minutes for your IM doses. Guys, anytime I've ever seen it, it's always been IV. I've not seen it being given IM. So again, it also helps control postpartum hemorrhage after an infant in the placental delivery. Again, and that's the key thing right there. You got to wait till you deliver the placenta before you give this drug. It should be administered to patients suffering from postpartum hemorrhage. And again, it's essential to verify that all the babies and the placenta have been delivered and that there are no additional fetuses in the uterus. Please make sure of that or you're going to get a surprise. Okay? Remember that it helps delivery, so guess what will be coming really quick if you decide to do that. Now, the biggest thing that I've heard about oxytocin is it can actually cause a uterine rupture or actually cause a prolapse uterus. So it can actually cause it to send out the uterus through the vagina. So again, if you get that prolapsing, again, very bad. Some normal side effects with this guy, with probably any smooth muscle relaxant. It does increase cardiac output. It will increase chest pain. You can get PVCs and tachycardia. You can drop your blood pressure with it. Again, for the fetus, though, it can cause intracranial hemorrhage. It can cause asphyxia or hypoxia. So that's why you don't want to give it while the baby's still inside, because the placenta then detaches. Guess what? You just cut off their nutrient. Again, it can cause bradycardia and ectopes in the fetus itself. So you got to make sure that everything is delivered. That is your absolute. And if you got an unfavorable fetal position, if you know for a fact that the feet are coming out first, probably oxytocin or Pitocin is not the drug for this patient. Again, other vasopressors can potentiate hypertension by using this drug. Okay? Again, you got to make sure if you're giving it to a pregnant female, you want fetal heart rates and uterine tones closely. Again, if they're giving it to induce, if they're doing this to induce labor, remember that one of the biggest problems is you can have the placenta separate. Okay, so obviously we don't want that to happen. We use it in conjunction with massage. You can use it with mass pants to increase the nerve and having the infant nurse can help control things. Again, it can cause placental retention if given prior to placental delivery. So again, it can hold on to the placenta or deliver it. So it can go either way on that one. It's usually supplied 10 units, U.S. pharmacopoeia units per milliliter, and a pre-filled syringe is how they usually do it, or is 10 and 5. And we usually mix that in 1,000 mLs to yield a concentration of 10 to 20 milliunits per milliliter. And then we're going to start that drip at 100 to 125 an hour, which will give us 10 to 20 units per minute, per hour. And we're not supposed to go any more than 20 milliunits per minute, okay? So again, you're not going to probably be, if you are giving this drug, you're giving it for postpartum bleeding. And so I don't want you to spend too much time on the dosing part. Because I can tell you as many doctors as we have just as many people who, again, they'll have different dosing, especially in the pre-hospital setting. Again, we usually give it IV or IO, hopefully IV. You can give it IM, and we just don't give it to pregnant people, period, exclamation point. All right, so that's it for oxytocin. It's a pretty simple drug. It causes the uterus to contract. If you remember that, you're good, okay? And we'll see you guys on the next one.